has been told that there is a need to wear a face mask if you're moving outside your home. If you're in the house, you don't need to be on the face mask. But once you are going outside and you know you're going to meet with people, you need to put a face mask. And by the time two persons are wearing face masks, they are protecting each other. But you see, a lot of Deltans are not obeying that rule, and it's not good enough for us. The numbers are coming high because our people are not following the protocols. Many people still believe, and they still say, the COVID-19 is not there, they are using it to, they are deceiving us. It's only the foolish one that will continue to say they are not there.
He advocated the need for everybody to be at alert as the level of immunity of people differs, pointing out that those with symptoms of the disease should go to the hospital for treatment before they become big risk to their families, members, friends, and colleagues. Governor Okowa promised that his administration would do everything possible to manage the situation and appeal to residents of the state to avoid large congregation of people to mitigate the spread of the disease. He reiterated that the 400 confirmed cases of COVID-19 recorded in the state as of June 18, 2020 was largely due to the failure of people to obey stipulated guidelines for the containment of the disease. The governor expressed worry that most states in the country would surpass the figures recorded in Lagos State due to the failure of most Nigerians to comply with the laid-down rules. Governor Okowa opined that the dreaded COVID-19 could only be eliminated with behavioral change of the entire citizens of the country. June 19 every year is World Sickle Cell Day, a day set aside by the United Nations to raise awareness about the red blood cell disorder and to raise funds to fight it. The 2020 International Day is exactly 12 years after the General Assembly of the United Nations proclaimed June 19 as the date to mark the celebration in 2008. The theme of this year's World Sickle Cell Day is Keeping Hope Alive, Sickle Cell Disease and COVID-19. The wife of the Delta State Governor and founder O5 Initiative, Dem Edith Okowa, has called on well-meaning members of the society to shun all forms of discrimination against sickle cell patients. Dem Edith Okowa urged Nigerians to lend helping hand in seeing that the sufferings of the carriers are alleviated. Dem Okowa, who was addressing journalists in her office at Asaba, explained the reason for her continuous campaign on genotype awareness and called for positive action regarding sickle cell warriors. She disclosed that the O5 Initiative has in less than 4 years established 13 sickle cell clinics across hospitals in the state with a referral center in Asaba Specialist Hospital. Dem Okowa added that the goal of our initiative was to have sickle cell clinics in all the 25 local government areas of Delta State. The federal government says it has released 4.5 billion naira to 31 federal teaching and medical centers in the country. Minister of Labor and Employment Dr. Chris Ngige disclosed this shortly after a meeting with President Muhammadu Buhari in Abuja. He explained that the 4.5 billion naira is to cover hazard and inducement allowances of the health workers nationwide for the month of April and May. The National Association of Resident Doctors embarked on strike 5 days ago to press home their demands for enhanced allowances and provision of facilities in the hospitals across the country. They also had threatened to withdraw its medical workers from the COVID-19 team. The Minister of Health, Dr. Sagen Hanire, has warned Nigerians to see the increasing number of COVID-19 cases in the country as an indication that the number of fatalities would also increase. Dr. Hanire, at a weekly briefing after a meeting of the task force on COVID-19, said the increase in number of fatalities could be mitigated if the most at-risk groups, such as persons aged 50 years and above and those with pre-existing ailments such as diabetes, cancer and hypertension, among others, were protected. He said as the number of cases rises, COVID-19 will kill more people. In his own view, the PTF coordinator, Dr. Sani Aliyu, said the government would not tolerate the flaunting of the relaxation guidelines. Dr. Aliyu said the